It's my pleasure now to introduce our keynote speaker, Christy Prang. And Christy, I want to make sure I read this so I get your title because it's a long one. Yeah. I want to make sure I get it right. Christy is the Training and Prevention Director at the Child Advocacy Center. The Child Advocacy Center in Lincoln, Nebraska is a nonprofit organization that provides a safe, child-friendly location for conducting forensic interviews and medical evaluations for abused children. It's a serious mission, and it is an organization that has been and Christy will fill in the details, but I know it's been around for a long time and has been extremely valuable, a valuable source in our community and surrounding areas. So without further ado, you don't want to listen to me. You want to hear from Christy Prang. Christy, welcome to our conference.
Yeah, thank
you.
It's all
yours.
All right. Thank you guys for having me. On behalf of the Child Advocacy Center, our board members, as well as our wonderful staff, we're so happy to be here and be part of this event. You know, Kiwanis and all you do for kids in the communities in Nebraska and Iowa, we stand beside you and help support those kids along their journeys too as well. So I always start all of my presentations with a nod to survivors. I think I would be remiss to not do that. And so just for the survivors listening today, I stand with you, I hear you, and I am a voice for you. Our people at the center are voices for kids and families every single day. So just know that if you ever need something, our center is available to talk. And so our mission is, you know, simply put, we're a place where small voices can be heard. And so we provide services for kids ages 3 to 18, including family members that there's been an allegation of abuse and neglect. And so at the core of really our mission, we seek justice and we seek to reduce trauma by providing that child-friendly environment for kids to come and really share their truths. And we know, unfortunately, with survivors and sometimes the amount of trauma that kids experience, that we're really only getting the tip of the iceberg. And so we work really hard to form connections, strong connections with community agencies that help wrap around and provide support. So the types of cases that we see, we work with survivors across the spectrum, and we know that all child abuse and neglect is bad, right? But we work with a very niche set of cases. And so the types of cases that we're seeing and the survivors that we're working with, about 70 to 72% of the time are going to be victims of sexual assault. So we're working with anywhere from 3 to 18 and their family members to provide resources and provide support for them while they're going through the hope and healing process of that. We work with children who have witnessed violent crimes, so survivors of domestic violence, whether that's an experience where they've witnessed a parent or a caregiver experience that violence, or they have been part of an altercation that has been violent. We also work with children that there's been an allegation of some type of drug endangerment. So we will bring the child in and we will provide that interview. And sometimes we will provide hair testing to see if there's been exposure. So that's kind of a medical component of it. Serious physical abuse, serious neglect too, as well as recovery from kidnapping. And I would also be remiss to say we have a fabulous core group of team members within the center, as well as working with partner agencies, including Health and Human Services, law enforcement, and probation, that are working what we call CSEC cases, so child sex trafficking cases, or high-risk youth that are maybe perhaps running away frequently, they're couch surfing, they have some type of court involvement, so they're on the radar, they're high risk. So we have a wonderful team that are wrapping their hands around those survivors and providing support and guidance and trying to keep those kids safe. So The types of referrals that we receive are going to be specifically from law enforcement or health and human services. And so we use those two investigative bodies to really bring us or help us access the children that need the forensic interviews. So at the CAC, we don't want to start our own investigation. That's not why we're here. We're here to be a service provider for health and human services and law enforcement to help protect these kids, keep these kids safe, or get them to a place where they perhaps will be safe by providing that interview. So I know Kathy was wonderful and kind of working with me to kind of gauge perhaps what you guys were looking for as far as the types of services that we provide, and then also where do you see those in Nebraska and Iowa. So there are 7 child advocacy centers across the state of Nebraska. And so we are in Lincoln. Obviously, our main sort of hub is in Lincoln, but we have 2 satellites where we serve children and survivors out of York and out of Auburn. And our service area really extends into 17 counties that really go up kind of into Polk County, over into Cass County, down into Richardson, and over to Thayer. So that really is our service area as a Lincoln site. Omaha has a center that you can kind of see our center on the screen there. It's very child friendly. It's very open and welcoming. We kind of structured it after a barn. So it's got very antique. I always say our founding executive director was the creator of Pinterest, because she just has a beautiful mind for creating a very welcoming and safe place. So the CACs are sort of governed under certain protocols, and really the National Center looks at accrediting each one of us. And so there are some things in place that make us very similar, but there are things that make us unique, and really building structure is just one of those unique characteristics. And so we are very fortunate. This building was constructed in 2011. Prior to that, we were in Antelope Park, and we really opened our doors in 1998 here in Lincoln locally. So Project Harmony, like I was mentioning, is based out of Omaha. They are co-located, so that means health and human services and law enforcement, as well as mental health and prevention, all work together in one space, which makes it nice for families and survivors to utilize those services kind of at the same building. It does very much look like a kind of a corporate building. It's not maybe so barn-like, so to say, but provides services as far as that Omaha office into Iowa too as well. So they have some counties that they work with. Norfolk is our northeast location. We have locations in Kearney, Grand Island, North Platte, and then Gearing too as well. So you can kind of see the I-80 corridor. We've got some facilities, and like I said, each one of them works just a little bit differently, but we all provide forensic interviews and advocacy at our core. In Iowa, there are actually 7 CACs too as well. And so those are kind of spread out. You've got one in Mason City, you've got one in Davenport, one in Des Moines. So again, they're kind of spread out. What I was noticing in doing some of the research for Iowa's is a lot of them are attached to a hospital, much like Norfolk's is attached to a hospital. So there's that medical component that's right on site. And a lot of that too, originally back in 95, 96, when we were kind of exploring what does this look like for Lincoln, we were looking at co-locating at Bryan. And so that's one thing that we ended up going to Antelope Park and starting the Little Yellow House there. But I know that those partnerships across the state and including Iowa are very, very strong. So the scope of what we see and the scope of the kids that we serve, I think, is sometimes it takes your breath away, especially when you look at the types of cases we see, because we don't see every single kid. We're not investigating every single case alongside law enforcement and health and human services. And so the types of cases that we see are very select. And so to kind of give you a scope of what we've done so far, we opened in 98 with one employee, Lynn Ayers, who just retired as our founding ED, and she served right under 30 kids that first year. Last year, we served 1,225 youth within our service area. And over the scope of the really young life of the Child Advocacy Center, we've served over 16,000 children. And so if you just take a moment to really understand the scope or what that looks like, I know many of you probably have been to the Pinnacle Bank Arena. And so that's enough children served to really fill that Pinnacle Bank Arena. And so when you look at about 70% of those cases through the longevity of the CAC's history have been working with children of sexual abuse. You start to gain the scope of the problem that we have, not only in Nebraska, but really nationwide. And so last year, our statistics, if you want to sort of get an age range, the survivors and the kids that we're working with, about 72 to 75% of them are under the age of 12. So we're working with very, very young children. 99% of the time, those children know their abuser, right? It's somebody that's known and trusted, and typically has been brought in by the family. So when we go out and we do education, not only with kids, because we're in schools working side by side with teachers, but when we go out and we educate professionals and community members, we're always gonna talk about the component of stranger danger, because there is still that opportunity out there and kids need to be aware of that. But we also need to be, and why it's exciting to be partnered with the Kiwanis, it's excited to be partnered with, other organizations that work with kids, is because you all have the capacity to put in policies and procedures into place to keep kids safer, even within your programming. You have the ability to put into effect systems that allow kids to feel safe with mentors like we have just heard from, right? Those one-on-one interactions that kids are having in your programming to feel safe and to find the courage to disclose if something's happening in their home. So what we know at the center is typically 72 to 73% of the time it's a family member that's committing these acts of violence. And so just a little bit of what we do and how we serve kids and how we connect with survivors is if they come to the center for a forensic interview, which essentially is one of our interviewers sitting down within an observation room with law enforcement and health and human services working. We're provided and trained in a basic protocol and an advanced protocol, and then sometimes a specific child sex trafficking protocol if those survivors are coming with that type of allegation. And we sit with them and we build rapport, and then we have them really discuss very intimate details of the case. And so we sit with them and then we relay back to law enforcement and health and human services. Kind of what I call the heart of the agency is really our advocacy program. So after they're done speaking their truths with the forensic interviewers, or maybe they just, it's not the right time and they, for whatever reason, do not want to disclose. Our advocates will still sit with the families. They'll sit with the families through kind of hearing some of that very raw details, and they will rebuild with the family. So like I had mentioned, we do provide medicals, and we also provide mental health services on site. With medicals, it's really, really important for everyone to understand that 95% of the times there are no physical findings in medicals. And so kids are so brave in coming to the center and meeting with our medical director, and they just have the opportunity to ask all of the questions about their body. Caregivers have the opportunity to ask questions, and so we support survivors through that process of healing their body and getting their questions answered. One of the final things and sort of the caveat of why I'm here is training and prevention and how we reach survivors out in the community. And so we've luckily been just so blessed to work with partner agencies that allow us access to working with kids within school systems, working with kids within youth programming. I've worked 15 years in child welfare to some capacity. So those community relationships to connect with kids in the community provide me, my mom always jokes, you just just have that face that everybody just wants to talk to. And so I've just been so blessed in my career to sit beside some of the strongest survivors and just to hear their truth. And so through training and prevention education, not only do we educate adults, we educate children. And so we are always one to host and be parts of these events, because we know for every one adult that is trained, they have the opportunity to save 10 children. So really think about the ripple effects of that. So again, I want to thank Kiwanis for having me, and on behalf of the CAC, thank you all for everything you do.
Christy, thank you so much.
Thank you. Thank you. Oh, yep.
Don't run off. Don't run off. We believe and support the mission of the Child Advocacy Center. It's a wonderful organization. You do great work. We've had some personal experiences with that, and we know that it's really good. Nebraska-Iowa District would like to make a donation.
Thank you.
And we want to take a picture.
Oh, yeah, very good.
Let's turn this up like this, huh? Make it look real official. And we've got it. Thank you so much, and best of luck, and keep up the good work.
Thank you.
Thank
Thank you,
you.
guys.